to use before I lost my leg was there's needles and everything lying about, so it was never really a safe place, you know what I mean?
Don't miss that. We will hear from drug users tonight. Also tonight, Scotland play England at football. We'll be live in Hampden and catching up with the legendary commentator Hugh Dan McLennan, whose last football commentary it is tonight. How much would you be willing to pay for a pint? There's a suggestion you might be charged more when it's busy.
Everybody's trying everything they can to try and attract customers in. So are your prices low during the week and high at the weekend, or just normal during the week or high at the weekend?
It's a good question. Kim Jong-un and Vladimir Putin meet in Russia, and this war between pedestrians and cyclists on the pavements with some pretty, we have the videos, pretty choice language.
From there to there, sir, you should have been walking.
Sorry, but I don't frankly.
You don't?
What am I supposed to do here then?
From there to there, just mind all pedestrians, just come off and push it.
Here.
Some of the language, by the way, is unbelievable. This is being shouted at some of the older pedestrians, and maybe this is something you've come across. Cyclists on the pavements, they're supposed to get off, aren't they? And in this bit of road we've been at, they are supposed to get off their bikes, they're not doing it. 80295 is the text. Nina Lazuri has the news.
Thanks, John. Good afternoon. Work to set up a drug consumption room in Glasgow could start within weeks after prosecution guidance was updated. The country's chief law officer said it would not be in the public interest to prosecute users of such facilities for simple possession offences. The move could help pave the way for them to be established, despite opposition from Westminster. Assistant Chief Constable Gary Ritchie said police policy would be to stay away from drug consumption rooms.
It's a health facility at the end of the day, so there's going to be no proactive policing round about that. It'll be for the division to obviously assess the threat and risk that surrounds the centre, but we provided some operational guidance and some policy guidance to our officers around that as well. So I don't see that having really a high demand for us whatsoever.
Wage growth has caught up with inflation for the first time in nearly 2 years. Official figures show that regular pay, excluding bonuses, rose by 7.8% in the 3 months to July. The data also means state pension is likely to go up by 8.5% from April, meaning a weekly increase of £13.30. A judge in Pakistan has ruled that Sarah Sharif's siblings who travelled from the UK with her father should be sent to a government childcare facility in the country. The 5 children were found at the home of their grandfather in Pakistan. 10-year-old Sarah was found dead at her family home in Woking in Surrey last month, a day after her father, uncle and stepmother left the UK. Caroline Davis is outside court in Gillingham.
He was trying to argue that he wanted to keep the children. He says that he's had them since they first arrived in Pakistan. He wanted to continue to have them. You could tell that the family were really quite upset at this decision.
The budget retailer Poundland has announced it will take control of up to 71 Wilko store leases. It expects to convert shops to the Poundland brand and offer roles for Wilko staff. The first wave of Wilko shop closures are happening today, with more than 50 shutting by the end of the week. All 400 of the discount chain shops are set to close by October. Police Scotland says boys as young as 13 are increasingly being targeted by so-called sextortion scammers. The victims are typically enticed into sending explicit photos and videos to strangers they've befriended online. They're then blackmailed into paying to make sure the images are not made public. Rising numbers of cases have been identified. And the weather tonight will bring clear skies, light winds and some patchy mist and fog, especially through the central belt. And it will be chilly, lows widely 4 to 7 Celsius, possibly dipping to 0 in some rural spots in the Highlands and the northeast. And that's BBC Radio Scotland News.
Nina said chilly. There we go. Sport, we're building up the so-called friendly part tonight. Scotland versus England. Joining us later on is from Scotland winger Pat Nevin. And if you're heading to the game, where are you coming from? 80295 is the text. 80295. Now, the drugs minister has been telling Parliament more about proposals for a consumption room for addicts in Glasgow. It follows a statement yesterday by the Lord Advocate, which appeared to offer a path to setting one up, even though drugs policy itself is reserved to Westminster and the Home Office doesn't support the idea. Our news correspondent Jamie McIver is with me. So, Jamie, what did we learn?
But we've got a few more details this afternoon, John. In particular, the possibility that the consumption room in Glasgow may be in the city centre. There'd always been speculation it could be there, but this will obviously add to that speculation. Now we know it's a definite possibility. Now, to remind you, the idea of a consumption room is that it would be a place where drugs could be taken legally. The argument being that it could be a way of helping to regulate and control drug taking, help those with an addiction recover, and help prevent deaths from overdoses or the spread of disease through dirty needles and so on. They're also known as overdose prevention centres, and for example, it could be a place where heroin could be injected under supervision. Well, this afternoon at Holyrood, the Drugs Policy Minister Elena Whittam gave a statement to Parliament both on drugs deaths and developments on consumption rooms. Let's hear questions, first of all from Audrey Nicholl from the SNP, and then from Sandesh Gulhani from the Scottish Conservatives, followed by the Minister's replies to them.
I call Audrey Nicholl, to be followed by Sandesh Gulhani.
Can the Minister set out the Scottish Government's next steps in supporting Glasgow to establish this vital facility?
It is now for Glasgow's Health and Social Care Partnership to take the proposal to the next meeting of their Integrated Joint Board, and I understand that that's scheduled for the 27th of September. In order to proceed, they will need to provide an update to their Integrated Joint Board and to be instructed to undertake a public consultation work as requested by the Lord Advocate to establish the evaluation framework for this pilot. That's so important, that public consultation work. We have been clear in our commitment to establishing a safer drug consumption facility in Scotland, and following the position from the Lord Advocate, we will continue to work closely with colleagues in Glasgow to agree the next steps and review options around implementation, including funding.
Implementation is key to any pilot. So my questions are, where will the rooms be? Will the local residents be consulted? Will addicts be expected to travel from local communities into towns and centres? And what support and interventions will be available in those consumption rooms?
Minister. The proposals that Glasgow is going to put before their Integrated Joint Board will actually include the detail of some of the questions that Dr. Gulhani is asking. But the consultation with the community is actually going to be really vital, because we need to ensure that there's no stigma associated with this and that communities definitely feel as if they've been part of the decision making. We know that there's between 400 and 500 people who are injecting in alleyways within Glasgow city centre, so I anticipate that this is going to include a city centre location as its proposal, and that I think is for Glasgow to set out, and we remain to see what they take to the Integrated Joint Board.
Elena Whittam, the Drugs Policy Minister in Parliament earlier on this afternoon, and certainly the mood music suggests that Scottish politicians aren't expecting the Home Office to try to find a way of stopping a pilot consumption room in Glasgow. Those plans for a consumption room could now be presented, as we were hearing, for approval to the Glasgow City Integration Joint Board, which brings together council and health officials, and its next meeting is due to take place on the 27th of September.
Interesting. And the latest drug death figures were out today, weren't they? What do they say?
Yes, John. Figures show the number of suspected drug deaths in Scotland has risen in the first 6 months of the year. Scottish Government statistics state there were 600 such fatalities over the period from January to June, which is a 7% increase in the same time last year. Comes after separate statistics published last month by National Records of Scotland, which showed a fall in deaths from drugs misuse in 2022, down by 279 on the 2021 figure.
Okay, thank you very much indeed. That is Jamie McIver. We're just wondering what people make of this. And here's what some folk had to say early on Kay's phone-in this morning about drug consumption rooms.
At the moment, people in cities across the UK are injecting in alleyways, abandoned buildings, rat-infested alleyways. So when you've got a consumption facility, they can come in there, there's clean equipment, it's a sterile area, they're not prone to things like HIV or hepatitis C. Of course, those drugs are still illicit. They are bringing their own drugs, which are purchased through the criminal markets, into that space. However, within that space, what you can offer is And what I'd like to see is widespread access to things like diamorphine-assisted treatment.
One, where do they get the drugs from? Two, you should actually be attacking the dealer that are supplying the drugs. Okay, all you're doing is putting a band-aid on a major wound here. These guys go to this centre, or these women or whatever, go to these centres and take their drugs. Then they get up out their chair or whatever and they walk out into the main street. I don't want to come across these people on the main street stoned out their box. 99.9% of them are getting it done in the house anyway. I lost a friend last month because of drugs. And if you had the centre to go to, you wouldn't have went there.
Having worked with people who use drugs for over 15 years and having lost people that I know myself from using drugs, the vast majority of people that I know who use drugs harmfully, who became dependent, had adverse childhood experiences, had grown up with material poverty. I had a range of coping strategies that were available to me. I had the money to seek help where I needed to. I could go to the gym when I felt stressed. A lot of these things are out of reach of people. People who live in the most deprived areas are now 16 times more likely to die from drug-related death, and that has doubled since that kind of recording has begun. So we cannot ignore the material conditions which are beyond the individual's control. We know these drive health outcomes, and we have to make sure that we make these changes and move forward.
Something about the time to see these lovely young people walking about the living dead, and I actually think it's just the best you can do for people. Just go and do it over there, we're going to write you off, and it actually makes me quite sad. And I sometimes have the thought of anybody son or daughter walking into a medical facility and sticking a needle in their arm, because that's the best we can do. It just makes me really upset.
Well, those are the thoughts of some of Radio Scotland's listeners, including some people who work in the recovery sector. Very emotional takes on the topic. And earlier, just cycling by, I spotted 3 people who I wanted to talk to. They turned out to be drug users, and I wondered how they felt about consumption rooms. So the first person I spoke to was John.
Been using for the last 25 years.
20, how old are you?
60.
You're 60?
Yeah. I'm not injecting, I'm smoking.
You're smoking?
I can't get a vein in anymore.
You've lost a leg?
Yeah. I can't get a vein anymore, so basically I've got to smoke it.
So what do you make of this idea that there should be safe consumption rooms?
I think that's a really good idea, because it means there's a lot of people who don't know about actually what they're taking, and when they're ODing, there's nobody there to help them, and the people that are there to help them are not there because the police come and then they get blamed for helping the boy to take the overdose. So having somewhere safe where people are trained to help people get into an overdose, then I think it's a really, really good idea.
I think the idea is that, you know, we know that at the moment when it comes to possession, the police would maybe report you if they and then they would test the drugs. But the safe consumption room would be somewhere you could go and take drugs safely.
I think that's really a really good idea, you know what I mean, because where people are going, they're going into places that are really manky, but under flyovers, and amongst bushes, and anywhere basically they can actually not be seen.
Yeah.
And half the places I used to use before I lost my leg was there's needles and everything lying about, so it was never really a safe place, you know what I mean? And if somebody to come up and say to me then, oh, we've got a wee safe place for you to come, where people are trained to help if they overdose or all the rest of it, and be safe, then I'd have jumped at the chance.
You'd have travelled to go? I'd
travel to use it, yeah.
Right, okay.
Not a problem. But I think it's a good idea to have places like that, because people are dying because they've not got anywhere safe. I'd rather go to somewhere where I know if I'm going to inject myself, then if I get into an overdose, they know what to do. Whereas out in the streets, if you're injecting in somebody's veins, then they don't know what they're doing.
Okay, thanks for talking to me.
Not a problem.
Thank you.
You're welcome.
Bye. There's another couple of lads here. Excuse me, fellas. Can I chat to you very briefly? I work for the BBC. I'm just wondering, are you both users of something? Yes. So let's say you've probably read or heard about the idea of somewhere safe consumption. What do you make of that?
I think a good idea. A good idea, eh?
Really? Because at the moment, where do you score just now? Just somewhere?
Anywhere, as long as there's like kids around, like that. Obviously, you do it.
And at the notice this kind of unsafe procedure?
Aye. What's your back in it?
Is it? So you would travel across town to
Aye. Anywhere really, anywhere.
Okay, we'll have more on this throughout the programme. There's 3 users, and there's lots to come tonight. How much we should pay for a pint. Some pubs in England are charging more for ordering during what they would call peak hours, and it's different here in Scotland though, and I've been finding out why.
In Scotland we have laws that mean if you're going to change prices, then you must change them for 72 hours. So anything that any group, especially English-based groups, if they've got places in Scotland, the laws are different in England, so they've got to adhere to those laws. It's got to be 3 days in a row. That was to stop happy hours, drinking competitions, and the irresponsible promotions that we did see previous to the 2005 Act.
So we'll have a look at this, the chain, how you could change the price of a pint or a drink maybe over the weekend as opposed to the week. We'll have a look at that. And I'd love your text on this next topic. 80295 is the text, because there is a big rammy, there's a big dispute between cyclists and pedestrians on the south side of Glasgow, and it's turning really, really nasty. We've seen the videos. It's because they're being asked to share a stretch of pavement, but cyclists are being asked to dismount because it's so narrow. The local campaigners say the majority are not dismounting.
Just a little bit of shared space where cyclists are asked to get off. Elderly people with pushchairs for kids, and the majority of cyclists now don't care. They just cycle on the bit they're being asked to dismount. It's not very big, it's only the length of the bridge.
Your worry is?
An old person, they break a bone or something happens that they lose confidence. We've now got 5 different elderly people complaining, too scared to go to the police.
Okay, we'll have a look at that. So 80295 is the text. So our listener Al says, John, as a blind guy who goes into the city, often it becomes an absolute dangerous nightmare with cyclists. E-bikes and now e-scooters all riding on pavements and pedestrianised areas. I now avoid Sauchiehall Street. I'm just about to head into town to watch the football in the city centre bar in the short stroll from Glasgow Central. I will have at least 5, maybe up to 8 close encounters with guys riding their bikes on the pavements and ignoring red traffic lights when pedestrians are crossing. We're not going to play out some of the language, but we've got video and audio of some of the abuse hurled by cyclists at, frankly, older pedestrians. 80295